be dancing and expecting an August visitor in the month of July. And the August visitor has. Remember I told you that he was looking for where to park that, to land that helicopter. So he's been looking, and lo and behold, boom! Our August visitor is now. Let's come together as we welcome our doctor in our midst, Dr. Daniel, MBBS, University of Lagos, PGDFM, National Postgraduate Medical College of Nigeria, certificate in LMIH, University of Washington, Member Society of Family Physicians of Nigeria, SOFPON, Member Association of Private Medical Practitioners of Nigeria, APMPN. He is the medical superintendent of Hero Medical Center. Put your hands together and welcome Dr. Daniel. And he will be talking to us on
Good afternoon, everyone. I'm glad to be here. God bless you all. I was almost joining in the dance, but I noticed I was not wearing it. So I decided to restrict myself. It was just a joyous atmosphere that I ushered me. God bless you. All right. We'll make it as brief as possible. Not speaking too much jargon, medical stuff, things that you can relate to. So, like my sister said, we are discussing cervical cancer. So there are two words there: cervical and cancer. Cervical is your cervix. I will, a very simple one, say the mouth of the womb. For those that have been pregnant before and you have babies, when they say one finger, two fingers, three fingers, we are push the cervix they are talking about. So we are talking about cancer taking place in that space. Before we look at the slides that we have here, the old cells go off. God replaces the old cells with new one. The cells lining the tongue, the cells lining the cheeks, the cells inside the eye, everywhere. They have normal rate of growth. As the old ones are going off, new ones are coming at a constant rate. With cancer, that control is lost. So the cells just go wild. They grow unnecessarily. If you are supposed to have 20 cells in a day, you are not having 400. So within 3-4 months, you have what they will call tumor, growth. Stuff that was also supposed to be there that is there, occupying space, causing pain, collecting too much food, too much oxygen. And if it's on the skin or places like the vagina or the cervix, when the normal coverage over that skin is breached, is broken, it's like a road that is broken, it will start bleeding. And many other things, bleeding, sore, abscess, and so on and so forth. That's cancer. It's just normal cells that start going over, become over, terrorists, kidnappers. Let me not say miracles. So they just grow up normally, no more control. That's what happens. So in the cervix is exactly what happens. The bleeding that comes is because the normal coverage over the cervix is removed because of excessive rate of growth of cells and community. Okay, so our outline will be definition. That's what I was trying to do. The definition function, we talk about how and how many people are affected, what are the causes, the risk factors, how do we see the presentation. what makes us suspect that somebody will probably is having a deal of situation with service. Then what will the doctor do to know that this thing that suspecting is cancer of the service? And then how is it managed? Then we round off. Before I continue, let me appreciate the organizers of this program. I saw your team. Wisdom is profitable to that, right? That's the key. God bless you. All right, the next slide, sir. So we are trying to look at the service. That's a very simple diagram of the service. The arm you are having like this is a tube. The place that looks like the body is a knee. The lower part, where you have that green mark, is a pipe. The pipe that is a cervix. The cervix is the pipe linking, connecting the vagina, the private part, with the womb up there. And then the part of it that is the womb, there is a certain type of cell that God uses to cover it. The almost that God uses to cover it. Pure water sachet that God uses to cover it. Then as it enters into that pipe, God uses another type of pure water sachet to cover it. Just like your house. What you use to cover mattress is different from the sheets. Is that right? What you use to cover the pillow is different from what you use to cover the mattress and all that. So that's just how it is. So the cells that cover the part of the cervix that stays close, that is inside the vagina, is different from the one that covers the pipe, the inner part of it that connects the vagina to the womb of to the uterus, because they serve different functions. So we say that the cervix is a lower narrow part of the uterus that connects to the vagina. The uterus is the side that looks like human arms. Then the arms out there is the tubes. It's also called the neck of the uterus. It's the gatekeeper part of the uterus, in the sense that when the menses want to come out, it passes through the cervix to the outside. When the man's semen wants to go inside the woman, it passes through that semen. So it's a gatekeeper. Gatekeeper is a gatekeeper. Also, when the pregnancy is established, it is shut off. So nothing goes in there again until either miscarriage or the baby is ready to come. Then that will cause blood to lose. And then other things will follow for the baby to come out. That's why we call it baby pipe. It's a canal, I said, so it's a pipe, it's a tube. It has two exits. The exit from the vagina in, the exit from the womb out. Two exits called the internal os, external os. And then it has two main parts. The A2, the one outside, the one that doctor, many of us are going to the hospital, they use something inside the private when they do. Or they stop the use when they want to do short HBS. If it's a doctor that is doing it, you will look at the cervix, the part that we see with our eyes, the ecto, and then the one that is inside is the endo. Why I'm taking time to say this is because the endo, like I said, has different covering. The endo has different covering also. The endo has different covering because it's mostly to protect. The endo has different covering because it's to produce stuff. During ovulation, it produces stuff to make that environment comfortable for the man's sperm to go into the and form it. So let's pay attention to that. And then it changes in consistency and function during menstruation, during ovulation, during pregnancy, and during childbirth. During menstruation, it will open up into it, so the blood can track out. After that, there's to shut off. Then during ovulation, it release solids. to make it easy for self to swim to go and meet the baby. And also from there, the inner part of it, that's where the slightly stuff you see ovulation, that's where it comes from. Alright. So the function that I said, big gatekeeper menstruation. Then some people during sexual arousal, they feel more excited when they feel more torturous when they touch themselves. There's some people who call it conjugal pain. That conjugal pain is not common. It's mostly when there's something going on there. That's when we want to feel conjugal during intimacy. The function of the cervix again, fertility, I've said it, fertility, preparing the cervix is at that gateway, which is passing by sperm. And then when they become what's to come out, the conception, pregnancy, labor, and we have discussed all those things. So the epidemiology has to do with what age group of people commonly show up with the cancer of the cervix. If you tell me that a 9-year-old child is having cancer of the cervix, I say, are you sure? If you tell me that a 75-year-old person is having cancer of the cervix, when did it start? This must have been there for a long time. So the epidemiology is telling us what age group are affected, what is the rate, how common is it. So in this slide, I said, let's go back to that. This slide, we are saying that it's the fifth most commonly diagnosed cancer amongst women globally. For women, talk of cancer of the ovary, cancer of the cervix, cancer of the breast, cancer of the womb, and all of that. So if you put them number one, number two, number three, number four, number five, cancer of the cervix will be the fifth number. As at 2022-2023, the figures have it that as much as can be diagnosed, up to 640,000 women have new cases of cancer of the cervix, and then out of that, 280 people died. The diagnosis was more in this our area, this our region, low income group. Nigeria, West Africa, South Africa, Africa in class. Then Southeast Asia, India, China, mostly because resources are not as basic. Some of those things in other parts of the universe, they are freely funded by governments. As we stand now, we are still struggling to have the vaccine available as normal. It's most likely if you want to take the vaccine, you have to put special order before you have it, before you get it. So the diagnosis, the number of people that are coming up with cancer of the cervix in our area, low income areas, is far more than what you have in the advanced countries, and the number of people that die as well is far higher in number. Why? Because most people don't have the information that encourages them to go for screening, and then you are told to go for screening, you are going to pay for it because government does not what they call it, subsidize. Apart from the fact that we are, when it has to do to going to the hospital to go and check, we are not too smart about it. We ask the fact that when you go there, you are going to be as school fees go up, house rent go up. And then access to vaccines, I've said that before. So when everything is put together, we find out that people between the ages of 34 and 44 years, 34, 44 are the ones that are mostly affected. But after that group, also have another group around 50 years that are affected. Then we are also beginning to see in our environment, people as low as 45 years that have a problem. Let's continue, sir. So what are the causes? The first and most important cause of cervical cancer is HPV infection. HPV is human papilloma virus. It's a virus. They say that up to 80% of sexually active women have that virus in their body. But 90% and more of the people that have the virus, your body immunity will fight it off. So that 90 years, 80 years, 100 years old, you have had HPV infection when it did not come to cancer because your body system which that killed it. Does that make sense? So the few people that the system cannot solve it out are the ones that come down with the sickness. And it is so also because the people that come down with the sickness, they are infected now. Before their body can fight it, they go back and get infected. Before the body can go, they go back and get infected. They go back and the body just away and not lie. And then let what also happen and the thing will also. We are going to see why that is like that. And then there are many types of the virus, but the short type 16 and 18 are the ones that really cause most of the problems that we have. I'll say the 90% of the patients are cleared by the body's immune system between 1 and 2 years. Only 1 to 2% of the treated cases progress to cancer. So we now see those people that their body finds it difficult to fight off. What are the possible reasons behind that problem? Why is it that some people can fight off, some people cannot fight off? In these factors, smokers, people that smoke, the nicotine from tobacco makes the cells misbehave, just like many other cells in the body. Smoking. People that are sexually exposed at very young age, most likely will have multiple sexual partners. And this one will collect them. Multiple sexual partners. A lady that has one guy and that guy has 10 ladies, it's a problem. People that are immunodepressed, like people that have things like diabetes that is not well managed, so over time the immune system is depressed, it's a problem. People that are already having HIV, it's a problem. People that have infection from chlamydia, it's a problem. Then also, if it runs in families, in some families that the natural immunity is not fair enough to fight this stuff off. People get to hear this one, that with cancer, that with cancer. In my office, a few 2 months ago, 3 sisters lined up and this breast cancer. 1, 2, 3, breast cancer, just lined up. One of them was with me. So as I was trying to go through her, she called the sister. The sister came. I want what the sister was trying. She also took me. So in the course of checking the card, I said, I need to examine the case. And I first stopped. When I said that was kind of, I always give my advance and the sister was 1, 2, 3. So family history is very strong. Meaning that if auntie had, sister had, pay attention to yourself. Does that make sense? And then poor diet. Diet is across the board. It's not only this one. Diet is across the board. When we are talking about diet, let's go back to the things that are eating in the village. What are they eating in the village? Vegetables, fruits, as much as possible. Vegetables, fruits. They are not cheap now. I mean, they are not cheap. You want to know how cheap it is when buy one food. So we have people that will tell you there's a normal grammar. To combine this, you don't go to heaven. Diet. Then they don't squeeze. Processed carbohydrates. There's something they call 3 white poisons: flour, sugar, salt. If you can manage those ones very well, you cross from this line and the other line. 3 white ones, please don't forget that salt, sugar, and flour. So, bread, be careful. Malts, gala, sausages, those things are baked. We want Nigeria's more snacks, right? That's what we do. So we can go for talking about carrots. Actually, there's a lot of people that have chlamydia infection. The chlamydia infection compromises that coverage of the cells, and so makes it easy for the virus to just in and go and create problem. Then weight. The situation with weight, especially in babies, is that we know people that are a bit on the weighty side, they tend to produce a lot of estrogen. And estrogen has a way of telling the cells to misbehave. So the estrogen is telling the cells to misbehave, and papilloma is forming. So terrorists and kidnappers, all of them combined before go around. And then one thing with the people that are a bit on the Jewish side is that even physical examination, which is one of the first line things we do, might be a bit challenging to this, and you might not even see clearly what you are looking for when you are waiting and shoot. Then the use of oral contraceptive pills, for those of us that use this. Now there are some that the estrogen is on the low side, mostly progesterone, that one is later. And then they also let us know that if you use it for up to 5 years consistently, not by what consistent for up to 5 years, that's when the chances just go up. So it's not the one you take to space between Daniel and Amos. Then after that one, bring Amos. That space and now take a little more to space between Amos and Daniela. That one was not possible. Let's continue, sir. All right, here we are, the cervix there. I don't know how many of us see this, where that group. Let me go back to this place. Are we seeing it? That's a good thing. Not supposed to be. This is cervix. This is so, how do we know what makes us suspect that the woman likely have cervical cancer? Now, the process will be going on for years without showing. The few people that the body cannot fight on that virus and then end up with the cancer, it takes between 10 and 20 years for the cancer to show up. Does that make sense? So over that while, we will go that anything is going on unless you go for check. Please, if you don't have anything to take home today, remember this one, going for check. Just go, let them check you. I have a friend that has BP, she's a bit on the chubby side. The two parents have BP, have sugar, died because of those things. So I told her, go and check your figures, pay attention to yourself. See, if you are down, a lot of things happen. As you are, when you wake up in the morning, take a bath, things like that, try to walk this normal. When you are down, that should not be so for all the time. You branch in the morning, go away, come back at night, and then people around you, they carry the body, if you are meeting, have the body of looking for how to see the morning before they go to work, come back to work, and all of that. And this is how you just start. Apart from the money you are going to spend, the pain of injection, the pain of the money you are going to pay, and all of that. So let's just see what we can do. So I'm saying this from experience. By the time you get to the hospital and see it is there, it's almost endless. So as we are well and alive, just walk anyhow, Go and check it. We'll come to that later, but I'm emphasizing it now. Very simple test. There is a brush. It's a call it brush. You just pass it through your right bit and pack yourself there. Take it to the lab. It's something long time since I came there before. It doesn't take more time than the time they used to do swap from the private. It doesn't take more time than that. And then they check it, they now come and tell you. They have stages. There are some that are suspicion, not suspicion. Normal suspicion. There are some that are strong suspicion, there are some that are legal. And at that point, the something is confined to particular, not widely, and they can just believe it. The way they are doing it now is what they call they use ice to kill the cell. And that's the end. So when they say chlorine is at that point, others, when they start putting here, like that, they say they will remove the wound. Holy Ghost fire. Let's continue. So how do we know what will happen that the person will suspect most likely is a problem? Like I said, the initial stage, 10-20 years before pregnancy. Then after that, the next thing before bleeding is discharge from the private and is normal. Initially it's watery, later it becomes brownish, then later it becomes more like black blood. So when you notice unusual discharge, what can say that? The first suspicion will be infection. But if the doctor will be kind enough to just put that instrument, look at the mouth of the food, to know if the cells there are okay or not, and solve the problems. The next thing that will happen is after intimacy with your partner, after intimacy with your partner, there is suspicion there. Then bleeding between menses is a reason to suspect. You don't know menses finish before the next one. You don't know. Don't be necessary. That check by the police coming. You have stopped menstruating. You have entered into what we call menopause. And then all of a sudden, it starts eating on the where is it? When there's undue discomfort with intimacy, by the time you start having pain in the abdomen or the back, it means there's something putting pressure somewhere that's not supposed to be. It can make people go to urine unnecessarily frequently. It can make people to feel pain when they are passing the urine. Then the smell, the discharge from the private can become so heavy and even foul. As you breathe yourself, you don't say this time who is going to smell it. You can cause constipation when the intestines are under pressure from other structures. And then the legs, most times when you walk on the legs, are just get completely swollen. Can we see the next slide? So, how do we know? When you go to see the doctor, how will doctor know? Is to first of all ask questions. That's what I call history. Ask questions. Of course, like we say, it's most likely either you are having too much discharge from the private, or your discharge is smelling, or you are bleeding between menses, or the menses is coming too much, or you are supposed to have thoughts bleeding and see menses and all of a sudden start bleeding. Those are the reasons why you go to see the doctor. So the doctor will ask you questions about all of that. Ask you questions about family planning, if you have children, how many children, what was the mode of delivery, how long ago was the last child, and all of that. We ask you questions, are you having BP, are you having your sugar? Then they come to the family, does anyone in your family have anything that we talk of? We ask questions already. So that's adequate history. So when you get to see the doctor and you decide to ask those questions, just pay attention to some place that you have. And then, like I said, speculum examination, very simple, straightforward. One of the teachers that taught us told us, if a woman comes and you are suspecting anything kind, you cannot look, put your hand, you cannot put your hand, put your leg, just make sure You go to that place and make sure your eye see it. They tell us now, across also, I tell you, the urine, I don't know, for night, I wake up 10 times. When I leave for you, travel, before we reach up, don't tell the day stop 5 times. Because you must put your finger inside the nose, go away from the prostate. You don't put it and put them. So I'm saying this to emphasize the fact that when we go to see doctor, please, the doctor is not intent on checking your body. You tell the doctor, check your body. So, speculum examination. Then the next one is pap smear, the one I was talking about. To use brush to remove the skin of the cervix. When I look at it now, there is test we do to know whether the antibody, whether the virus has entered your system. Normally, when external organisms enter our system, the body will produce what they call antibodies. So the higher the concentration of the antibodies, the more we know that that stuff is active in your system. So one of the things you do now is to check whether the antibodies produced by your body against the virus is there. That will increase the suspicion and then let us know what to do. In some cases, if we do pap smear and it's suspicious, we want to do that blood test to confirm it, to help us know, is it something we have to wait, or is there something we must, is it something we must attend to now? There's another one they call conclusive, is to put medical equipment that has magnifying glass inside your body. So instead of using your ordinary eyes to look at the surface, that equipment will show more detail. Like those days when we do biology, I don't know whether they see it. Magnifying glass. I used to look at tiny specimen. I don't know whether they see it. Then biopsy. Biopsy is taking the tissue from the cervix, send it to the lab, let the pathologist go and process it and tell us whether it's normal or abnormal. We also do, when there is suspicion, they can do something like this. Don't bring out the tissue, use a instrument to suck out the tissue, send it to the lab. Of course, with that suspicion,